Oretab batet kotuitos kundit ak borto ak kotinye kebeberwek cheterterchin chenaat kou cervical, thoracic, lumbar, sacral ak coccygeal sections. Kora kotinye oretab batet body nerves cheimukyin biik koyai kasitab kila betut. Kamwa kanyoindet agenge Dr.A Kashmani kole imuche kesich kabotinosiekab oretab batet kobun tuguk cheu pikipiki.
The commonest causes of spinal injuries in our setup include road traffic accidents, especially currently with the borders. There is a lot of spinal cord injury resulting from the border accidents, motor vehicle accidents, fall from heights, people climbing trees, in the rural areas for fruits, open ditches, open holes, manholes. Those are the commonest causes from which we get spinal cord injuries coming to our hospitals. Lower back pain is one of the most common complaints in the world, actually, especially with the increase in the sedentary lifestyle in the current generation, in the current era. The various causes can be, you can have discogenic pain, you can have degenerative causes, you can have inflammatory causes, infective causes, but the commonest cause of lower back pain is degenerative. It is having a high impact on socio-economically, especially with the increase in sedentary lifestyles.
Kandagi muche kinya kabotinosiekab oretab batet komwoe kanyoindet noton kole biik chechang komachenge kanyoiset en kasarta nemagat, kit neibu paralysis.
Spinal injuries, unfortunately, by the time we receive the patients, they have complete cord injury, and unfortunately that leads to total paralysis, either of the whole body or of the lower limbs, and with that they lose control of urine, control of the stool. They cannot move their body, so they are fully dependent on people to help them move around. So that psychologically also has a great impact on the patients, and thus the request, the need for rehabilitation, neuro-rehabilitation for the patients, whereby they require training to do intermittent catheterization, how to move the patients so that they don't get any bed sores. Also, generally, the psychological aspect also, that has to be also looked into.
Kora, ngwanindab suet ak eng kebeberta nebo ng'onyab batet kotiengei ak ole koripto oretab batet chi ak amitwogik cheome koboto tuguk alak chechang.
It used to be common that the elderly people population used to be coming with lower back pain, but now it is more increasingly frequent to see younger people, as I mentioned, because of the sedentary lifestyle, the use of borders, the spinal impact, the impact on the spinal, on the bony vertebral column, smoking, the use of junk food, the increased use of junk food, lack of exercise, all those are contributing factors, and we are seeing more and more of the younger generation coming with constant lower back pain, for which they generally require surgical intervention. So this can be prevented by the people taking a different approach to how they look after their spine. The seating habits, the way they sit on the chair, taking care of their posture, taking care of eliciting frequent exercises, generally eating a healthy diet, having a healthy diet. All these are contributing. These are preventive measures that one can take, to improve your spinal health. So the commonest causes degeneration, whereby just the body changes occur as you age. But as I mentioned, of course, it's more common. It's becoming now common in even the younger generation because of our lifestyle. Generally, discogenic back pain is the most common cause of back pain, for which we try to treat them non-surgically at first, and if it fails, that's the only time then we take surgery as an option. Infective changes, especially TB, is quite a common cause of morbidity, whereby patients come in late with spinal cord compression because of TB abscess, and that is also a common cause. Inflammatory conditions, spinal cord tumors also, those are now increasingly becoming common. So generally, of course, in the whole world, the use of pesticides, fertilizers, chemicals, all this has been contributing to the rise in cancer cases also.
Konyoisetab oretab batet ko yatitaet cheterterchin. Kou ole kamwa Dr. Kashmani, en kit nekates kole kimuche keyai yatitosiek tugul en Kenya.
We are offering various types of treatments, from open surgeries to minimally invasive surgeries. For trauma, most of the patients unfortunately arrive when they have complete spinal cord injury, whereby they are paralyzed completely. So prevention of such cases can be bringing them on time, availing services, ambulance services and referral facilities to various areas for earliest treatment, making treatment available at the earliest time possible. And for trauma, most of the time we need to stabilize the spine. So if there is that involves insertion of implants into the vertebral bodies, into the bony structures, and stabilizing the spine. If done in time, of course, there is chance of recovery. And for the lower back pain, which is degenerative, secondary to degenerative changes, we can also provide minimally invasive techniques, whereby we have endoscopic procedures, spinal endoscopic, which can be done even as outpatient procedures under local anesthesia, and we do them under local anesthesia, whereby the patient comes in the morning and goes back home in the evening walking. No need of anesthesia. We do it under the microscope also, using tubes. The advantages of minimally invasive spine surgery are quite a few, whereby there is less trauma to the muscles, the soft tissues. There is less bleeding. There is less risk of infection. There is less, reduced hospital stay. Also, the cost factor definitely then goes down. So, various advantages to minimally invasive spine surgery. It is done through small incisions. You have special instruments that you insert into the areas where the pathology is, and with all those advantages, the patient goes home even the next day or within a day or two. If required, then we need, if stabilization is required for the spine, for the fractures, spinal fractures, then we generally have to stabilize with screws and rods. And for degenerative changes, lower back pain, if surgery is required, then either open surgery, which is now becoming more and more obsolete, but and more of minimally invasive surgery is becoming common in the world in general. We can offer also endoscopic spine surgeries under local anesthesia, we can offer microtubular decompressions. We can offer minimally invasive surgeries for stabilization also. So we offer all kinds of spinal surgeries. Currently we offer all these services here in Eldoret. Minimally invasive spine surgery and also minimally invasive brain surgery. We offer endoscopic brain surgery and endoscopic spine surgery, microscopic spine surgery, minimally invasive stabilization also of the spine in Eldoret. I see no reason for patients to leave their own country, leave their own homeland and traveling abroad to seek such services. As a matter of fact, all these services are now available at home. So a patient goes to another country, spends a lot of money, complications may arise, you don't know whose door you're going to knock at. I think it's just a matter of time when people become aware that all these services are now available at home, whereby we do the same surgery at a reduced cost at a place where all your relatives are, your home is. I think it's a matter of time when people will realize that these surgeries can be done at home, and there might not be any need to travel abroad until and unless it's absolutely necessary. I think we are bound by ethics when dealing with patients. The money aspect of it, in general, I think it is still much cheaper to do such specialized surgeries at home. Unfortunately, it comes to be known that the doctor is the one charging. Unfortunately, that is not true. With minimally invasive spine surgery, of course, the cost of implants is a little higher than the normal implants. The investment also is much investment in terms of time to train for these techniques, investment in terms of the instruments required for such techniques. But it's still definitely slightly higher than the open surgeries, but not to the extent of the cost of traveling abroad and getting operated abroad, and it's definitely much cheaper at home.
The minimal invasive technology ko technology nekikeyai mising eng emetab India. Abwati eng betusiek chechang ko kicham kekase biikab Kalenjin chebo bororietab Kalenjin kelen kakimut mgonjwa sikeyochi operation eng emetab India. Ko ki technology nito necham kesor eng emetab India. Ko kei hospitalitab Reale ko kikeyai a lot of investment kele takitoret bororietab Kalenjin ak ketoret biikchok chebo Kenya kehakikishan kele kakiibu technology nebo gaa asikosikyi kekerende makobendi biikchok emet neloo amu tinye gharameshek akichek ng'alek chechang, mi usafiri, mi ng'alekab ndegeishek, mi tiketishek, mi hotelishek chipkemenye eng emetab sang. Ko kikeyai kende rabishek chechang kabisa kele tasikyi keibu muswoknotoni konyo gaa, ako eng betutab rani kokaworo surgery eng agenge chechang chekokeyai eng betusiek chekobo ain let. Minimal invasive surgery ini ko surgery ne ngeyaun rani kotinye kelchin, ako kelchin netai nebo surgery ini ko cost effective. Nebo aeng kora kuhusu less invasive surgery ini ko kumetepche mising kora eng sipitali ku atkinye kicham keyae ku muswoknotet nekibo zamani nekicham keyae open surgery. Nebo somok kora ko tinye kirindo ng'alekab infection. Sana ko matinye infection amu melen kele kakiyote kora oretab batet, so chances nebo infection kora komi ng'weny.
Kobaten konyoiset ko kamwa inendet kole nyolu korib biik oretab batet asimat kosich kaimutik alak tugul.
Prevention, first and foremost, we have to streamline or put down rules and regulations which have to be strictly abided by, especially with the motor vehicles, with the borders, observing lane discipline, simply observing traffic rules will result in a great reduction in many of these spinal cord injuries. jinsi tunavyoweza kujichunga na madhara ya shida za mgongo ni kuacha kubeba vitu vizito ukiwa umeinama, kuinama sana wakati pia nyumbani watu wanalima shambani, wanafaa kutolima wakati kutoinama wakiwa wamebeba vitu vizito, kutumia bodaboda sana pia, hiyo pia inaweza kusaidia kujikinga na hiyo madhara ya shida ya mgongo. Kuwa na posture ambayo inafaa, kuwa na upright posture kila wakati umeketi, na kula vizuri, kuwa na balanced diet, pia kutovuta sigara. Mambo kama hayo pia inachangia kuhifadhi mgongo. Pia ni muhimu kwamba jeraha za spinal cord ambazo zinatokezea baada ya accidents, ni muhimu sana tufuate sheria. Ni muhimu sana tuwe tumevaa mavazi ambavyo zitatusaidia wakati accident kama vile helmets. Lakini muhimu sana ni kufuata sheria. Tukifuata sheria itakuwa tumejisaidia sana, tumejikinga na haya madhara yote ambazo zinatokezea na ajali za barabarani, especially wakati siku hizi ajali za bodaboda ambazo zimeongezeka.